This is a short video on orbital anatomy. Today we'll be exploring the nasolacrimal system and its relation to the bony orbit. The nasolacrimal system. This is a collective term for the apparatus that is responsible for producing and draining the tears. There are 5 key structures that comprise the nasolacrimal system. This includes the lacrimal gland, the puncta, the canaliculi, the lacrimal sac, and the nasolacrimal duct. The final drainage pathway of the nasolacrimal system is the anterior portion of the inferior meatus of the nasal cavity. The lacrimal gland. The lacrimal gland resides in the lacrimal fossa of the frontal bone, and it is split into 2 lobes, a large orbital lobe and a smaller palpebral lobe. The smaller palpebral segment lies below the aponeurosis of levator palpebrae superioris and extends into the upper lateral fornix, whilst the larger orbital segment primarily resides in the lacrimal fossa. The lacrimal gland is supplied by the lacrimal nerve, a branch of V1, the ophthalmic division of trigeminal nerve. We briefly discussed the lacrimal nerve in the fissures video, but to recap, the lacrimal nerve travels through the superior segment of the superior orbital fissure. Remember, this is a segment that carries 4 key structures and is part of our helpful mnemonic LFTs. The lacrimal nerve provides sensory and sympathetic fibers to the lacrimal gland, but the postganglionic parasympathetic fibers for secretion travel from the pterygopalatine ganglion and hitchhike on the zygomatico-temporal or occasionally the zygomatic nerves to reach the lacrimal gland. The sympathetic fibers arise from the superior cervical ganglion and join the parasympathetic fibers to regulate both blood flow and secretions in the lacrimal gland. Tears are secreted from the lacrimal gland into the conjunctival sac, shown here, allowing for the formation of a lacrimal lake. There are other accessory glands present in the upper eyelid that contribute to the secretion into the conjunctival sac, which provides some redundancy on maintaining the cornea moist in case of lesions that might impact the lacrimal gland. Clinically, the main function of tears is to keep the corneal epithelium moist so that most important refractive structure of the eye is preserved. Inflammation of the lacrimal gland, known as dacroadenitis, is often viral in nature, with EBV being the most common culprit. Besides infection, other etiologies can afflict the lacrimal gland, including inflammatory, such as thyroid eye disease or IgG4 disease, infiltrative, such as sarcoidosis, and neoplastic, such as lymphoma. This presents with tenderness over the lacrimal gland region, ophthalmoplegia, limited ocular motility, proptosis, and occasionally the characteristic S-shaped lid. The conjunctival sac and the lacrimal lake. The conjunctival sac is the space between the palpebral and bulbar parts of the conjunctiva. Tears formed from the lacrimal gland will travel during blinking from the superior lateral portion of the conjunctival sac towards the medial canthus to form the lacrimal lake. There are small, raised, round orifices that are situated near the medial canthus called lacrimal puncta. They are present in both the upper and lower eyelids and are in line with the tarsal glands of the eyelids. Individual punctums are responsible for conducting tears towards the next portion of the nasolacrimal system, the canaliculi. Clinically, probing and irrigation is a procedure that is often used in ocular plastics to assess the anatomy and functionality of the nasolacrimal drainage system. For example, this is useful in cases of eyelid trauma to assess for the integrity of the drainage pathway, and in cases of congenital nasolacrimal duct obstruction. The canaliculi. Each canaliculus measures about 10 mm in length and consists of a vertical portion and a horizontal portion. Each canaliculus after 2 mm dives sharply medially along its horizontal portion and pierces the periorbital fascia to join the lacrimal sac. Prior to entry into the lacrimal sac, both the superior and inferior canaliculus might unite to form a common stem known as the common canaliculus. The lacrimal sac. The lacrimal sac is approximately 12 mm in length and is situated in the lacrimal fossa. This is visible in our atoms model and is formed by the lacrimal bone and the frontal process of the maxilla. This was mentioned in our bony orbit video. The lacrimal fossa is bounded by 2 bony projections. This is the anterior lacrimal crest, formed of the maxillary bone, and the posterior lacrimal crest, formed by the lacrimal bone. The lacrimal sac sits in the lacrimal fossa and is bounded anteriorly by the orbital septum and the lacrimal portion of orbicularis oculi, posteriorly by orbital fat, superiorly by the zygomatic process of the frontal bone, and infralaterally by the lateral rectus muscle, and medially by the anterior ethmoidal sinus. Clinically, dacrocystitis, different to dacroadenitis, is inflammation of the lacrimal sac. Most commonly this occurs due to an obstruction within the nasolacrimal duct and causes a stagnation of tears within the lacrimal sac. Acute dacrocystitis often only requires systemic antibiotic therapy and can be managed medically by treating the causative agents. Commonly this is staphylococcal, streptococcal, and pneumococcal bacteria. Chronic dacryocystitis often presents with less inflammation and requires surgical therapy. Congenital dacryocystitis is often secondary to obstruction at the valve of Hassner, located at the most distal portion of the nasolacrimal duct, which we'll discuss later on in this video. The nasolacrimal duct. The nasolacrimal duct is approximately 18 mm in length, and it connects the lower portion of the lacrimal sac with the inferior meatus of the nose, completing the final pathway for the drainage of tears. The nasolacrimal duct has two separate segments, an intraosseous portion, which is approximately 12 mm in length, and a membranous portion, approximately 6 mm in length. The intraosseous portion enters via the lacrimal groove, highlighted here on our Atoms model, and descends the nasolacrimal canal, formed largely by the maxillary bone. The membranous portion runs the nasal mucosa and terminates just below the inferior nasal meatus, which is difficult to visualize in our Atoms model. The nasolacrimal canal is a short bony passage that houses the nasolacrimal duct as it travels downwards and backwards into the facial skeleton. The medial wall of the canal is formed by the lacrimal bone, highlighted here, and the inferior nasal concha bone, difficult to see on our Atoms model. The bulk of the nasolacrimal canal, though, is formed by the maxillary bone. The nasolacrimal duct opens into the anterior portion of the inferior meatus of the nasal cavity. The opening is guarded by a single thin flap of mucous membrane known as the plica lacrimalis, also known as the valve of Hassner, which prevents air from entering the lacrimal sac when blowing the nose. There are other valves that are present in the nasolacrimal system, and up to 8 have been described in the literature. Some are worth noting and they are highlighted here. Clinically, obstruction anywhere along this nasolacrimal drainage system may be an indication for stenting. This can include the punctum, canaliculi, lacrimal sac, or the nasolacrimal duct. There are numerous types of stents depending on the location that requires intubation in the nasolacrimal system. Further resources. Further resources on the nasolacrimal system can be found on BlueLink, a useful resource by the Anatomy Department of the University of Michigan and the University of Iowa, which provides some useful summary on anatomy and its clinical application. These will be referenced in the description below. Otherwise, thank you for listening and stay tuned for more orbital anatomy videos.